For many Americans over 60, the flu is often underestimated. It's easy to think of it as just a bad cold, something uncomfortable but manageable with rest and soup. The reality is very different. As we age, our bodies don't fight infections the same way they did decades ago. The immune system becomes slower and less responsive, which means the flu virus can spread more easily and cause far more damage. This is why older adults are the group most likely to face serious complications and the highest risk of death when flu cases rise across the United States. One of the biggest dangers of the flu in older adults is how quickly it can turn into something much more serious. What may start as fatigue, a sore throat, or a mild cough can progress into pneumonia within days. Pneumonia is especially dangerous for seniors because it directly affects breathing and oxygen levels, making even simple activities like walking to the bathroom exhausting. Many flu-related hospitalizations among people over 60 are not caused by the virus alone, but by pneumonia that follows it. The flu can also put extreme stress on the heart and blood vessels. During an infection, the body works harder to fight off the virus, raising heart rate and blood pressure. For seniors with a history of heart disease, high blood pressure, or past strokes, this added strain can trigger serious events such as heart attacks or strokes. Even people whose conditions are usually well controlled can suddenly find themselves in danger during a flu infection. Another often overlooked risk is how the flu affects strength, balance, and mental clarity. Older adults may not always develop a high fever, which can delay recognition of the illness. Instead, the first signs might be unusual weakness, trouble standing, confusion, or dizziness. These symptoms significantly increase the risk of falls, especially at home. A simple fall during the flu can lead to broken hips, head injuries, or long-term loss of independence, outcomes that can be life-changing. The flu also has a way of making existing health problems worse. Diabetes can become harder to control when the body is fighting infection. Lung conditions like asthma or COPD may flare up, making breathing more difficult. Kidney function can decline if dehydration sets in. What makes this especially dangerous is that these changes can happen quietly and rapidly, often before someone realizes how sick they truly are. Statistics consistently show that the majority of flu-related deaths in the U.S. occur in people aged 65 and older. This is not meant to scare, but to emphasize how important awareness is. The flu is not just an inconvenience for older adults. It is a serious health threat. Understanding this risk is the first step toward protecting yourself. For seniors, taking the flu seriously means acting early, paying attention to subtle changes in how you feel, and not waiting until symptoms become severe. The goal is not fear, but preparation. When you recognize that the flu carries real dangers at this stage of life, you're far more likely to take the steps that can truly protect your health and your independence. The most important step in flu prevention for older adults is getting a flu shot every year. Many seniors wonder if it's really necessary, especially if they've had mild flu seasons in the past. The truth is that the flu virus changes every year, and immunity from previous shots does not last. Annual vaccination gives your body updated protection against the strains most likely to spread. For people over 60, doctors often recommend a high-dose flu vaccine or a vaccine designed to boost immune response. These options help the body produce a stronger defense, which can significantly reduce the risk of severe illness, hospitalization, and death. Even when the vaccine does not completely prevent the flu, it almost always makes the illness milder and shorter. However, vaccination alone is not enough. During flu season, exposure matters just as much. The flu spreads easily through the air when people cough, sneeze, or even talk in close indoor spaces. That's why avoiding crowded places becomes an important form of protection. Shopping malls, indoor events, packed restaurants, and large gatherings can dramatically increase exposure risk. When going out is necessary, wearing a mask in clinics, pharmacies, public transportation, or other enclosed areas adds an extra layer of defense. For older adults, this small habit can prevent weeks of illness. Hand hygiene also plays a key role. Flu viruses can live on surfaces like door handles, shopping carts, and elevator buttons. Washing hands with soap and water for at least 20 seconds, especially after being in public places, reduces the chance of bringing the virus into your home. When hand washing isn't available, alcohol-based hand sanitizer is a practical alternative. These simple actions may seem routine, but they are powerful tools in preventing infection. Another often overlooked part of prevention is maintaining overall physical resilience. Staying well hydrated helps keep the body functioning properly and supports circulation. Many seniors drink less water to avoid frequent bathroom trips, but dehydration can weaken the body's ability to respond to infection. Sipping water throughout the day, along with warm soups or herbal teas, supports both immunity and energy levels. Limiting alcohol and excessive caffeine is also important, as both can contribute to dehydration. Sleep is another cornerstone of prevention. Getting at least 7 hours of rest each night allows the immune system to repair and recharge. Poor sleep weakens the body's defenses, making infections more likely and recovery slower. Keeping a consistent bedtime, maintaining a comfortable sleeping environment, and avoiding heavy meals or screens late at night can improve sleep quality significantly. Managing chronic conditions is also part of flu prevention. Conditions like high blood pressure, diabetes, heart disease, and lung disease make flu complications more likely. Taking medications exactly as prescribed and regularly checking blood pressure or blood sugar helps keep the body stable. Stopping medications during illness without medical guidance can be dangerous, so consistency is key. Ultimately, prevention is about layering protection. Vaccination, avoiding high-risk environments, practicing hygiene, staying hydrated, sleeping well, and managing existing health conditions all work together. For Americans over 60, these steps are not about fear, they're about control. By taking prevention seriously, you reduce the chances that the flu will disrupt your health, independence, and daily life. Unlike younger adults, older people may not develop a strong fever when they get the flu. In fact, many seniors never spike a high temperature at all. This can create a false sense of security. Someone might feel off, but not sick enough to worry. Instead of fever, the earliest signs are often subtle and easy to dismiss. Unusual tiredness, weakness in the legs, feeling lightheaded, or simply not having the energy to do normal daily tasks. These changes can happen quickly, sometimes within a single day. One common early symptom is sudden fatigue that feels different from regular tiredness. This isn't just feeling sleepy after a poor night's rest. It's a deep, heavy exhaustion that makes routine activities feel overwhelming. Walking from one room to another may feel harder than usual. Tasks like cooking, showering, or even standing for a few minutes can feel draining. When this kind of fatigue appears suddenly, especially during flu season, it should never be ignored. Another important warning sign in older adults is weakness or instability in the legs. Many seniors describe this as feeling wobbly or unsteady. You might notice yourself holding on to furniture more often or feeling unsure on stairs. This weakness increases the risk of falls, which are already a major cause of injury in older Americans. A fall during the flu can lead to broken bones, head injuries, or long hospital stays. Recognizing leg weakness early can prevent these serious outcomes. Mental changes are another red flag that families and caregivers should watch closely. Mild confusion, trouble concentrating, or feeling unusually disoriented can be early signs of infection in older adults. Someone who is normally sharp and independent may seem forgetful, slower to respond, or slightly confused about time or routine. These changes are often mistaken for stress or aging, but during flu season, they can signal that the body is struggling to fight off an infection. Loss of appetite is also common and often overlooked. Skipping meals, feeling nauseated, or not wanting to drink fluids can quickly lead to dehydration. Dehydration is particularly dangerous for seniors because it can thicken the blood, strain the kidneys, and increase the risk of strokes. When appetite drops suddenly and is paired with weakness or fatigue, it's a strong signal that something is wrong. Respiratory symptoms in older adults may also start mildly. A dry cough, slight sore throat, or hoarse voice may not seem serious at first. Many people assume it's allergies or a minor cold. However, in seniors, these mild symptoms can quickly worsen and spread to the lungs. What begins as a light cough can turn into pneumonia within days if not treated promptly. The most critical window for action is the first 24 to 48 hours after symptoms begin. This is when antiviral medications work best. These medications don't cure the flu, but they can shorten the illness, reduce complications, and lower the risk of hospitalization when taken early. Waiting too long, hoping symptoms will pass, can mean missing this window entirely. Many older adults hesitate to seek medical care because they don't want to bother their doctor, or because they fear being told to just rest at home. This hesitation can be dangerous. Doctors would much rather evaluate early, mild symptoms than see a patient arrive in the emergency room days later with severe complications. A simple phone call or clinic visit early on can prevent a serious crisis. It's also important for seniors to trust their instincts. If something feels wrong, it probably is. You know your body better than anyone else. Changes that may seem small, moving slower than usual, feeling unusually weak, or struggling to think clearly, are not normal and should not be brushed off. Family members and caregivers play a crucial role as well. Sometimes older adults don't notice changes in themselves, but others do. If you notice a loved one over 60 acting differently during flu season, sleeping more, eating less, moving cautiously, or seeming confused, it's important to encourage medical attention quickly. Recognizing early symptoms isn't about panic, it's about awareness. The flu doesn't always announce itself loudly in older adults. Instead, it whispers through subtle changes that are easy to miss. Paying attention to these signals and acting within the first 2 days can dramatically reduce the risk of serious complications. For Americans over 60, early recognition and quick action can mean the difference between recovering safely at home and facing a life-threatening hospitalization. During flu season, never ignore unusual changes in energy, strength, appetite, or thinking. Acting early is one of the most powerful tools you have to protect your health and your independence. Staying properly hydrated is critical. As people age, the natural sense of thirst becomes weaker, which means many seniors don't drink enough fluids throughout the day. During flu season, this can be dangerous. Even mild dehydration can make the blood thicker, slow circulation, and increase the risk of dizziness, falls, and stroke. It also makes it harder for the body to regulate temperature and clear infections. A good goal is to sip fluids regularly rather than trying to drink large amounts at once. Warm water, broth-based soups, and mild teas are excellent options, especially in colder weather. These fluids are easier on the stomach and help maintain hydration without discomfort. Alcohol and excessive caffeine should be limited during flu season. Both can pull water out of the body and interfere with sleep. While 1 cup of coffee in the morning is usually fine, relying on multiple cups throughout the day can quietly worsen dehydration. Replacing some coffee with water or herbal tea can make a noticeable difference in how the body feels. Sleep is another powerful form of protection. Quality sleep allows the immune system to repair itself and respond more effectively to viruses. For older adults, getting at least 7 hours of sleep each night can significantly improve the body's ability to fight infection. Poor sleep weakens defenses and increases inflammation, making illness more severe and recovery slower. Establishing a regular bedtime, keeping the bedroom quiet and comfortable, and avoiding screens late at night all support better sleep. Keeping the body warm also matters. Chilly temperatures can place extra stress on the immune system. Seniors should pay special attention to keeping the neck, chest, and feet warm, especially at night. Wearing warm socks, using extra blankets, and avoiding drafts can help the body conserve energy for healing rather than temperature regulation. Together, hydration, sleep, and warmth form a simple but powerful foundation for health during flu season. These habits don't require special equipment or medication, just awareness and consistency. For Americans over 60, small daily choices like drinking enough fluids, resting well, and staying warm can make a meaningful difference in reducing complications and supporting a faster recovery if the flu does occur. If breathing becomes difficult, that is never something to sleep off. Shortness of breath, fast breathing, or feeling like you can't get enough air are urgent signs that the lungs may be involved. At this age, flu-related breathing problems can worsen rapidly. If walking across the room leaves you winded, or you feel pressure or tightness in your chest, seek medical help immediately. Trust this instinct. Waiting even a few hours can make treatment much harder. Chest pain or pressure is another signal that requires fast action. Many seniors assume chest discomfort is just muscle strain from coughing or fatigue. But the flu can strain the heart, especially in people with high blood pressure or heart disease. If you feel chest tightness, heaviness, or pain that doesn't go away, call your doctor or go to the emergency room. It is always better to be checked and told you're okay than to wait too long. Mental changes are one of the most overlooked danger signs. Confusion, trouble speaking clearly, extreme drowsiness, or feeling out of it are not normal flu symptoms. These signs often mean the infection is affecting oxygen levels, blood pressure, or brain function. If you notice sudden confusion, either in yourself or a loved one, this is an emergency. Do not assume it's just fatigue or age. High fever that does not come down with rest or over-the-counter medicine is another warning. While older adults don't always develop a fever, a persistent or rising temperature can signal that the body is overwhelmed. Likewise, if symptoms seem to improve for a day or two and then suddenly get much worse, this is a classic sign of complications such as pneumonia. This pattern should always prompt immediate medical care. Managing chronic conditions during the flu is also critical. If you have diabetes, heart disease, lung problems, or kidney issues, continue taking your prescribed medications unless your doctor specifically tells you otherwise. Stopping medication on your own can be dangerous. Check your blood sugar if you're diabetic. Monitor blood pressure if you have hypertension. Small changes can become big problems quickly during illness. Here's practical advice you can apply today. Make a simple action plan before you get sick. Write down your doctor's phone number, the nearest urgent care, and which hospital you would go to in an emergency. Keep this information visible on the fridge or next to your phone. Let a family member or neighbor know that you want them to check on you if you're sick. Having a plan removes hesitation when time matters most. Another helpful habit is to pay attention to patterns, not just symptoms. Ask yourself, am I getting weaker? Am I thinking clearly? Is walking harder than yesterday? These questions reveal danger earlier than waiting for dramatic symptoms. The most important message is this: you are not overreacting by seeking help early. You are being smart. Doctors expect older adults to come in sooner, not later. Early treatment saves lives, shortens recovery, and protects independence. If there is one promise you should make to yourself this flu season, let it be this: I will listen to my body, act quickly, and never wait out serious symptoms. That decision alone can protect your health, your home, and your future.